The state's health department believes one of its chemists fudged the numbers on testing for drinking water for years. 9 News Investigates first broke this story this month. Aaron Adelson explains exactly what the chemist is accused of doing.
Late last year, the state health department's lab leaders realized they had a problem. They found one chemist manipulated the data for a specific drinking water test. They now believe she had been doing that since at least 2020.
As a scientist, that one hurt.
Dr. April Hill teaches chemistry at MSU. She explains before you test what might be in the water, for quality control, you test a chemical you know before and after. That's to make sure the device is working.
So it lends some trustworthiness to the answers that you get for the unknown samples.
Instead, CDPHE told the EPA its chemists would combine different quality control tests together, replacing failing results.
From the day that students step into a general chemistry lab, their first day of college as a science major, they are taught that you do not cherry pick your data. You do not decide you don't like it and throw it away. And you certainly can't take data from 2 different tests and mash it together and act like it passed that test.
The state's report explains the chemist ran the tests on an older device not connected to the internet. So the chemist needed to export data onto a thumb drive and then manually enter it onto a computer.
That leaves some room for mistakes or, as the case may be, fiddling with the data before you upload it.
The report states when the chemist was put on administrative leave, she tried to hide her thumb drive, which had the raw data. This action from Chemist A demonstrates she knew her actions in changing data were wrong. Because of this chemist, the state recalled results from more than 7,000 tests, and the federal government revoked the state's certification to perform a number of tests. A CDPHE spokesperson says this manipulation affected 3% of the state's drinking water systems. The state's chief medical officer does not believe there is an immediate public health threat.
If it's monitored properly, they should have caught this a long time ago.
In Denver, Aaron Adelson, 9 News.
The chemist has since retired from the health department in May. The department tells us a deputy director at the lab also resigned.